Hi YouTube, it's Courtney, or vsgredesignme. I am coming to you with a 2-year, 1 month, something or another, almost 2 year, 2 month update. I had vertical sleeve gastrectomy in January 2015. My highest weight was 345 pounds. My lowest weight was a hot minute of 197. And right now I'm sitting at around 208, which is a some regain. I had been sitting comfortably at 200, 201 for a while, and then life happened. So I'm coming to you right now from a different state. Not too much of a different state, although my New Yorker in me cringes by saying this. I am now living in New Jersey. I moved down here to be closer to work. I work for a major nonprofit in New York. They're actually a national nonprofit. With the election came a lot of turmoil at work and a lot of stress. And I decided, and Josh decided and agreed that it was time to move closer to the city so that we weren't so stressed with our commute on top of everything else. So I cut my commute one way from 2.5 hours down to less than an hour. And that's pretty good for New York City standards. So we live a few miles outside of New York, and we're in northern New Jersey. And I only live like 45 minutes from Gretchen, and she was nice enough to help me move. But yeah, we're settling, and we had to downsize our apartment from essentially 4-bedroom, 1.5 bath townhouse down to a 2-bedroom, 2-bath apartment. So there was a lot of selling of the stuff and a lot of packing and a lot of stress on top of the normal stresses in life. So here we are. So my certiversary came and went. I didn't even think about it, to be totally honest. It was like, oh yeah, that happened 2 years ago, and wow, here I am. And then I ate all the things. I ate all of the things. So, with moving and stress comes a whole bunch of bullshit, and not having food in the house, or you move to a new area and you start exploring the different restaurants, and Josh and I like drinking craft beer, so I'm drinking beer and doing things that I shouldn't be doing, that I know I shouldn't be doing, yet here we are. So that equates to about, I'd say, 8 pounds regain. Part of that has to do with the medication I'm on. With all the stress, my migraines came back, and they were really bad. There was 2 full weeks where I just could not function. So my doctor put me back on my migraine medication, which is known for having weight gain. And so I popped that week right up 4 pounds. It was overnight. And I thought it was swelling because I had gone into the gym, because we have a gym in our complex. And I thought it was because I was running out on the treadmill, and it was the first time I was really physically active since my plastics. But I think it was actually the medication, and now I'm retaining water from the medication, so I'm going to have to work extra hard to deal with that if I have to stay on the medication. But I'm also eating carbs and bullshit and stuff that I shouldn't be eating as a weight loss surgery patient, so half of that is definitely me. Some of it's probably the medication, but most of it's probably 75% me, and the rest is just apathy. So I am going to be working on just making sure that I'm better, to make it 90-10, 90 committed, 10% fucking around. Because that was working out for me for the last 2 years, and I've kind of let that slide down to 60-40. So the weight gain hasn't been as bad as it could be, but it could be better. I could not be gaining weight. So yeah, that's the general life update. Plastics update, everything's going well. On Tuesday, I had a revision on my breast and on my tummy tuck. It was a very minor in-office revision. I was awake for the entire thing. It was just local anesthesia. It went great. I was really sore on Tuesday night and on Wednesday. Feeling better today. I only notice when I bump into something, or now if I get jostled around a bit, that's when I can feel it. But essentially, he just did a minor revision on the inner portion of my breast to round them out a little bit more. And on my hips, I had some dog earring and some folding on my outer hips. He said that that's pretty normal with how wide my hips are, and the only way to really combat that would be to do a 360 or to do an extended, and he didn't think it was worth this scar to do that. So he did it, he fixed it as best as he could, and I'm totally happy with it. Right now I'm swollen, but just from me going to the gym and losing this extra 10 pounds that I think I'm holding on to, I'm totally confident that I'll be very, very happy with everything. You know, some of you are going into plastics. I know Melly May's going in, and there's a lot of stress involved in that. And my best advice there is just when you go into plastic surgery, if you're thinking about it or whatever, go into it with realistic expectations, because if you don't, you're going to be really disappointed. Like, I mean, my boobs were jacked up. Like, they were so bad. The fact that this is the only revision that I need to have is a testament to my surgeon, and I give him a lot of credit for that, and I chose him specifically because I really thought that he was the right person. He's researched minimizing scars and lowering scarring on mastectomy patients. So anybody that's had a double mastectomy, he's very, very diligent on lowering scarring and stuff, and I liked his research on scar minimization. He also didn't push a reduction on me, which I wasn't thrilled with a few other doctors. But you have to kind of go into it knowing what you're going in it with, and be realistic on the expectations on what you're coming out with. My breasts had very, very thin tissue, skin. It was very, very like paper thin, and so there's definitely some areas where there's scar spreading underneath my breast or where it didn't heal quite right, and you just kind of have to deal with that. It was what I was left with, and the same thing goes with my tummy tuck. You know, my scarring isn't great there, and it's not him, it's just my skin and my body and how I scar. You can actually see on my knee that I scarred exactly the same way on my knee as I did on my stomach. It's half, and I can't imagine what it would look like if I had a less skilled surgeon. And then also I had the seroma problem, which added another scar on top of everything else. So he did everything he could to make my scars look as good as they could, and they're as low as you could possibly ever want them. So I'm really, really happy with my results. But in that, like, I still have loose skin. Like, I still have a roll here when I sit, like, because I'm 200 pounds. You know, I still have loose skin all over. I mean, my arms aren't that great. My thighs are definitely not pretty, but you have to kind of go in it knowing that the tummy tuck isn't going to give you washboard abs. It's not going to make you look much different than where you are now with your shape. There's only so much a surgeon can do, and you have to go in with realistic expectations about that. But I will say this, if you have a skilled surgeon, you will definitely come out looking better than you did before, and that you'll be happy with your results as long as you're realistic about the expectations and your body shape and what your surgeon can do for you. So having said that, I mean, I'm very, very happy with my results. I obviously, you can see I'll post a video after this, you can see in my video that there's definitely some shape difference now with that weight on me. That's one thing I noticed, that I can tell when I've gained even 2 or 3 pounds now. I can see it in my shape, and that's something that was hidden before by this skin. So in some ways, the plastic surgery has made me more accountable for my weight loss and keeps me on track a little bit more, or at least stresses me out a little bit more when I gain those few pounds, because I can actually see my shape changing. And it's hard. Like, I've gained a few pounds, and I can feel the tightness in my abdomen from the fat, and if I swell up on top of that, I can get really uncomfortable. So make sure you're at your lowest weight that you want to be at, and then make sure that you can keep and maintain that weight, because the last thing you want to do is fuck up all that hard work and all that money you're spending on this surgery. So That's my little rant about that, but all things considered, I think everything looks great. I'm very, very happy with my results. I couldn't have asked for a more attentive surgeon, and I feel really good about everything. Now I just need to get my eating under control, and I need to get exercising again, and I think everything else will fall into place. So I go back and see him on next Thursday, and hopefully he'll clear me to do exercising and stuff. I kind of went gung-ho when I went to the gym last week, and I really need to ease myself back into it. There's definitely some swell hell happening when I go and I work out. I can see a major difference in my abdomen and the swelling when I do that. Some nights I look pregnant. It's really bad, and I don't know if that has to do because I keep thinking, well, you had your surgery in August, so you're really far out at this point. You shouldn't have as much swelling. But then I think about the seroma, and that happened in November when he did the extraction. That was essentially a second surgery. So I think I'm where I'm supposed to be right now in terms of swelling. I just kind of have to get over this hump, and I should be a lot better off by the springtime. So, yeah, I think that's it. I don't really have much else to report. Everything's good, and hopefully I'll come back soon with an update saying I'm back down to my normal weight. But yeah, if you have any questions about plastic surgery or my surgeon in particular, he's based out of Manhattan and Long Island with very, very reasonable surgery rates, or whatever. If you just want to drop a line, leave a message below, and I will talk to you all soon. Bye. Hi everyone. So here's I don't even know what it is. I'll talk about it in the video before this. So as you know, I just had my revision done on my tummy tuck, which is just some scarring here, and I also had a breast revision. So and the cat's locked in here because it's her own fault. So here we go. This is what I look like now. I had my tummy tuck in August. It's now February. I'm swollen in my hips right here from the surgery on Tuesday, but this is just it. See? So this is my scarring now. These are where he, this is where he did the revision, so that's why I'm swollen in here. Just two small things. This is where the seroma extraction happened, that's why it looks different. I had some bad keloiding over here, but this is the drain incision from my seroma extraction. He said that if I wanted it fixed, he would do it, but I mean, as you can see, like I'm so low. This is my pubic bone here. Can't go much lower than that. And then just this light up into here. Pretty flat today, considering I'm up a few pounds. But, with my underwear up, you can't even tell, so I don't think it's worth it. You can see in here right now I'm swollen a bit. This is just fat I have to lose. I'm wearing my surgical bra again. So this is what I look like now in my breasts. There's nothing in here, so this is literally just my boobs sitting where they sit. I can show you underneath my scarring. That's a seam from the bra. This is the actual scar here and here, so you can barely see it. And this is the piece that he surgically fixed. So it was just a little too boxy here, and he just pulled it in so it's slightly more round. But yeah, so with clothes on, no support, no shapewear. That's it.